Good. Happy New Year.
Thank
We're gonna
you.
bring this Health and Human Services Committee meeting to order. It's January 14th, 2025 at 3:47 p.m. We are going to start with, I believe our packet has us starting with youth, unfortunately, Commissioner.
Oh, that's great.
Well,
So
I put them together.
Yeah, so,
You're okay with that?
yes, absolutely. I don't have much. But in terms of, the leadership banquet this year, it's going to be Wednesday, May 21st. So we'll get everyone's, their invitations out early enough. Hopefully we have not run into other people's, last year we ran into a couple of issues with scheduling. So hopefully Wednesday, the 21st will be good.
I'll be there.
Yes. For the most part, we have our Columbia County Youth Advisory Board meeting tomorrow night. So that will be the first of the year. And we'll be working towards getting the nomination forms out to the schools, getting everything moving in that direction. We have, as you know, the contracts, the county contracts are now like another 20 pages. So Annie Delaney's been helping me with the updated contracts with our providers as well. So that's going on right now. And for the most part, that's it.
The additional pages of the corporate compliance that we're required to do now.
Spend this money.
Still, I mean, still waiting
Out
here,
there.
still out there.
We're getting ready to hire a lifeguard. That starts next week.
further questions for Director Grandinetti? Thank you very much, sir.
Thanks for putting your.
Commissioner Gibson.
I
Good to
got
see everybody.
Thanks.
Happy New Year. With the agenda here, so requesting authorization to approve a monthly rental fee to
Move it.
second.
Further, all in favor?
Aye.
requesting authorization to approve fee to Otis Elevator for their annual maintenance.
And then reverse, but I'll move this one.
Yeah.
Do I have a second?
That's on me.
On us.
I just, I approve. I mean, I'll give a second.
Further discussion.
Yeah. Have we looked at anybody else? Because, I'm sorry, Matt, what was that?
Oh, for Otis, I'm sorry.
Because I used to use Otis in my town and they were dreadful and triple, quadruple the price of the company I have now.
So shall we put it out?
I don't know how you want it. I'm just bringing it up.
Give it to Brian McDonald, give him the information.
Yeah,
He
because
usually
there's a
solicits
company in
those.
Red Hook, it's a father and son, and they give you a contract, they
We
include a
use
lot.
Otis around the county for a number of different things, so, you know.
You use Otis for everything?
Yeah, I mean, I do the courthouse,
Oh, you
a
don't
few
mind?
others.
I'm gonna reach out to Brian and just have him call him, right?
Yeah.
Right?
Meanwhile, you want me to table?
No, I'm not saying anything, I'm saying that
You know,
Asking, yeah.
I hate when I have to say these things because
it's not a lot, you don't have a lot of options, basically. you know?
Well, it's not just that, but I'm guilty of something that I don't like, which is to say, I don't know, they always use that.
Right, yeah, we
No, I
always
get
do
that,
that.
yeah, no, I get that.
That's what I'm doing. I'm happy to look elsewhere.
When do you normally?
Are we
do the
happy
maintenance?
with their service? They come when you need them?
They have.
Okay.
They have. I've never, no news is good news.
When do we normally do the maintenance?
This time of year.
So if we're doing it now, we should do.
No,
this
no,
next-
I'm fine, I'm just talking about, we should be looking into some.
But there, my point is, we use Otis for a number of different contracts, so
Fine,
Brian
fine,
talked to
fine.
him on a general
I'm not looking
basis.
to do anything other than bring
Think
about
about
a name that I.
Right,
didn't
sure,
have.
yeah.
That's
And
all.
we
Can
may
we
get a
leverage that to get a better price?
different
That's
price.
what would be my thoughts.
Well, then, let's take this up at budget time and we'll think about doing that. That's.
All right, so you have a motion. right?
We had
I'll
a second.
Okay, that's just,
So all in favor?
Aye.
Carried.
just so you know, Supervisor Mia's on electronic.
Oh, that's why we're.
That's why you're hearing him say aye. Just so it doesn't scare everybody.
All right, and then, finally, just a request, to enter into an agreement with, the Independent Living Center. The reason I have to do that is, somebody moved from Rensselaer County to Columbia County and they get CDPAP. And, I don't have a direct contract with these folks. And in fact, that all may change come April, the way the state's gonna align some things. But by then, this gentleman will have been switched over to Medicaid and it will all be good. So. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
All right, I won't go too deeply into numbers because I only do that when you ask, but let me just say that, I've had over 20 at the Midford most nights these last couple of weeks. I don't have any rooms
So you
left.
started at 16 costs and you,
I'm at 22,
yeah,
don't have any rooms. Yeah, it's a day-to-day thing. Let me just say that to you. So there's that and the fact that, I continue to get poached by the state. We'll get into that next month, but, and so I now have senior positions that I'm not, even if we move and agree we want to fill them, I don't think I can. They're senior positions. So, and they're luring people away. You can work from home. So, I don't know, somebody call up there and say.
Bob, those few months that you had 106, I can't see those, 168 is that? Families, individuals and families.
Yeah, it's a combination.
What's the total right now?
In real time, I'm not quite sure because that
180?
changes, but it's not any low.
It's been pretty consistent for the last.
Yeah, I
couple
was gonna
months.
say it's pretty
Yeah.
consistent.
What's concerning is it doesn't change during the summer.
Right, like it used to, right?
No, it does not. So, we see the housing going up. That's a plus. We could use some more units like that going up. I think I mentioned that some of these folks are self-paying at this point and just waiting for the next apartment. And we got a big lift ahead. And we will have to sit down, not this month, but we're gonna have to talk about, personnel. So, okay.
So Bob, the vacancies though are low. So did you have vacancies at the end of the year that weren't reflected?
Yeah.
Okay,
so it's more than 16.
And they're at the supervisory level.
Yeah.
And so I'm not asking to fill them because I don't have anybody to fill them. That's my problem. So, we've just run into this all this. Oh, we could talk about it.
thank you.
Thank you,
Thanks,
Commissioner.
Bob.
Thanks, guys.
Office of the Agent. Oh, I'm sorry. Health Department.
Hello. Hey, Karen. Good to see you both.
Yeah. A couple resolutions tonight. Request for authorization to appoint 2 members to the Board of Health, Doctors Moncash and Stearns.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Request authorization to accept 24 MRC Operational Readiness Award from NACHO, National Association of County and City Health Officials.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Request to accept Performance Incentive Award from New York State Department of Health.
Move it.
Second.
Further discussion? All in favor?
Aye.
Carried.
And request to contract with preschool agency to provide preschool services to eligible children.
Always. I'll move it.
Second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. Come on up, Supervisor.
And then I've
Oh,
got,
you my delay. No problem, everybody. We have a new member on our committee, Supervisor Martin. How are you? And all Collins from Chatham. We've met Kathy Eldridge from Greenport, my deputy chair, Ron Knopf, Brenda Adams, Rob Lagona, and Chairman Morrell. And this is Director Victoria McGann.
and I'm just getting into my December monthly report. If anyone has any questions, probably won't surprise anybody. Lots of norovirus, lots of COVID, lots of flu. A slow start to the flu season, but it's It's,
Is that norovirus still around?
yeah, oh yeah. Oh yeah, we had, several, outbreaks at long-term care facilities. It's extremely contagious.
I had it. It's
Yeah,
awful.
so, yeah, yeah.
That's what everybody's saying. It's like
Yeah.
the
It's
worst
awful.
thing
It comes
they've
on
ever
you
had.
like a truck. You have no idea.
Yeah.
Like, what's going on? You got a couple of aches, pains, you don't feel well, then,
Yeah.
boom.
They're thinking there's a mutation in the strain that's going around this year, and it's brutal.
3 days, it's like you're fine.
Yeah, it's
So
crazy.
that chart, can you go back up? That was-
This one?
We were. Just looking-
Our reporteds are low, comparatively between different, years. But we did have 2 deaths, unfortunately, due to COVID, long-term care facilities. And 7, 8, for a December, it's not bad, but. it's
But are
a
they
little
still
bit-
reporting?
No, not everybody is reporting.
Right, and the ones
Correct.
that do report, I mean, they say COVID, but they could have a million other comorbidities. It's the
Well,
same, right? Or then even, how do you know they
As far
died
as
from
deaths,
COVID?
you mean?
Yeah,
the ones that we see are people with lots of other comorbidities,
Yeah.
but they are definitely suffering from
Okay.
COVID. It's COVID that really, unfortunately, pushed, yes.
okay.
And how much participation have you seen in the most recent COVID vaccination program? I mean, has it waned even further?
I think so, yeah. For sure.
Anecdotally, my doctor said that less than half of his patients were getting COVID shots.
I did read today though that nationally over 65 has been a solid, their uptake is solid on the COVID vaccine. But overall, I'd say it's continuing to dwindle.
Do we know the age ranges of the 2 mortalities?
So they were residents of a long-term care facility, so they were elderly, but they weren't in a nursing home.
Okay.
It was an assisted living, so they were self-sufficient and healthy enough to be in an assisted living rather than a nursing home.
Oh my God, sir.
All right, any further questions for the director on her report? Thank you very much.
Thank you.
Thank you.
Thank you.
Maybe we'll see you next month.
Oh, I don't know what I'm looking for.
All right, now we can get to the office of the agent.
Thank you. Nice to meet you. All right, so while it feels like I haven't sat down since November, I surprisingly don't have a whole lot for you, which feels weird. Quarterly report, I think I sent it correctly this time. So you can see our case management, congregate meals, home delivered meals throughout the fourth quarter there. I don't have any numbers for the Everhome pilot as that has now ended. Case management. Transportation trips has stayed about the same, but we are about to introduce, which I think I may have mentioned, I can't remember if I mentioned it at the last meeting, something called GoGo Grandparent, which is an initiative through the state. We received a $10,000 grant from NYSOFA. Or I guess we didn't really receive it directly. It wasn't one that we had to accept. It just kind of comes through the initiative. And we're looking to implement this in the Hudson area so that it'll take the pressure off of our transportation program to deliver rides to the further out areas of the county to kind of see how it goes. Hopefully it goes well and we can continue to receive funding through that initiative from NYSOFA. So I'll report back on that when we kick off.
So what is it? Like go.
Oh, sorry. GoGo Grandparent is kind of like Uber for older adults. It goes through the existing Uber and Lyft companies that are in place.
Which are very limited.
Right, we've got about 5 Ubers and maybe 2 or 3 Lyfts, I think is what they reported, that are active. And then it'll also work with the local taxi companies. So we'll see how it goes. It's kind of a, why not give it a try and see.
Sort of hit or miss, I hear, for people that try to get an Uber in the county, it's not great.
Yeah.
I'm hoping that with GoGo being involved, I don't know if they give an extra boost to the driver. It will provide rides. We're planning to do rides, like I said, to the Hudson area residents, only limiting it to them. And then it will also provide rides after our office is closed and on the weekends. So it will open up opportunities for people. And while our transportation services internally are non-medical rides, because we contract out with Healthcare Consortium to do medical, GoGo Grandparent could be used for anything. And, you know, we ask that they give us 24 hours notice. GoGo, you could call and say, I need a ride in 20 minutes. We'll see if it works, but if they have the option. So stay tuned.
And your outfit's actually paying for the ride through this
Through
grant.
NYSOFA, yeah.
Right.
So we decided to kind of get the best bang for our buck, I suppose, would be limiting it to the area where we know Uber and Lyft exists. And it's
Okay.
probably like, you know, someone calling on Green Street for a ride is more likely to get an Uber than someone out in Canaan, right?
Right.
Realistically. So we figured if we limit it to that area, it'll be more useful. And then our transportation can pick up more out on the outskirts.
Is it reimbursable or is it voucher or?
It's a voucher through, kind of the state just handles it. We're given an allotment, I guess, for this $10,000, but it's already in their system through the state. So we don't really ever touch the money.
How do you get that out to the public? And I was gonna go back to I know you got an email from one of my residents about meals.
Mhm.
Like, I think you have one person and also it's taking the meal,
I
like,
think there's two.
yeah, so how does the Office of the Aging
Get the word out.
get the word out in general? Cause like, we have a new committee in my town that they probably could call you, but, yeah. Same thing. I mean, that seems to be the biggest issue, like knowing who the seniors are, how to get the information to them.
Yeah.
So you have a new program, GoGo, whatever it's called. How do people find out about it? How do people find out about the meals?
I would go through our advisory council, which we're still kind of building and working up the kind of how that process works. But I was actually just talking about it with Dan earlier. We created this form, which is a template for people who aren't maybe necessarily comfortable coming up with what to collect on their own. But the expectation of advisory council members would be every meeting that we have every other month, you come to us with a report from your town about the needs. And, you know, maybe the need is meals. I don't know, this isn't a good example, but, and then the barrier that we think might be the reason why there is this need, why they can't get it within the town. How do we get in there? And then on that same form, the backside is a report from our advisory council back to the town boards and to their areas. So we're trying to build up communication that way. We would put it on our Facebook page, which, and, oh, you know what? I should start adding this here. The engagement on our Facebook page has been growing, which I think is interesting. It looks like it's still that above 65 number, but I can see the younger ages are also growing. I don't know how accurate that Facebook information is, but it's interesting to watch. So I think caregivers are also getting this information too. We could put it onto our newsletter, which goes out. The
How does that go
e-newsletter,
out?
we mail it typically, but then we've also started doing an email newsletter, and that has been growing as well. Not,
So how do you get emails?
how do we collect people to sign
Yeah.
up for it? There's a sign up sheet on our website.
Okay.
There's, it should be a link on our Facebook page, but now that I'm thinking about it, I don't know if it's kind of pinned. And then there's in the physical newsletter, which is another, that'll be coming around if it hasn't already made it into your mailboxes so that they're out at town halls and things like that. There's a information in the physical newsletter on how to sign up for the e-newsletter if people are
Good.
interested.
Do you also do it at your annual
the
picnic or
sites.
whatever?
Yeah,
Like, get
anytime.
everybody, right?
Anytime we have an event, I have this really obnoxious bright blue QR code, sign up for the e-newsletter or the physical newsletter. So we try to get the.
You probably don't know the answer to this, but how many emails do you have?
You know, I looked at that list today. I want to say we're in the 25 range. So
25?
it's not a lot of email
100?
addresses. No, just 25. Most of the email or most of the newsletters go out snail
See,
mail.
that's a problem, not for you, but for all of us is what I'm trying to
But
say.
there's also a bigger problem. I mean, we checked in, I think I checked in November, December, the advisory council membership was down 25-30%. There were towns that had no members on the advisory council. So I think we need to I know you're working on.
Both up, yeah.
And we just appointed 2 new members, so you'll have 2 new members, but I was,
And we just got a new member from Livingston as well.
but the thing, the exchange that you were talking about, I don't think our advisory council member has ever made a report to the town board. We don't get any
We don't either.
information. So I think
I
that
have
maybe
sometimes.
if we get pretty.
Yeah, I do.
Job description.
Well, we used to,
Now,
but then
we used
it,
to, so you
person left, so now I have a new person.
Yeah.
I'm just,
Can you send me that email directly and then I'll get it to this new committee we have? But
Yeah.
this email list that you have of 25 people is pathetic. So is ours. We're all the same.
Yeah.
Like, we got to figure out a way to
speak
get
for
people.
yourself.
I was gonna say,
How's yours?
Brenda, did have many
700 out of 1100.
Well, then you're not pathetic, so you go sit in the other room, but most of us are pathetic.
But do you
So-
share like what their email
I
to
will
have your
send
people
their
sign up?
email out across my list, but I will not share names because people
Yeah,
only
she's
sign
not
up if
the
you
head person,
agree.
though. She just does that.
Right.
But we have a new aging committee and I just gave it to some, we have a chair. Love to get that information to her and I'll get you her email if you email me.
Yeah.
But, like in my town, we have, I think, 500 emails or 600, which isn't horrific,
lot.
but how many of those are seniors, right? Like to target seniors for some of this stuff, which you could be targeting too, I guess, for some of the vaccines if we had these email lists, but I don't know how.
We've got 2 newsletters being mailed to Austerlitz, because in that email back to Barbara, I gave her.
So they just go to everybody?
It
No,
goes
she
to
says
2
a total of
people in
2
that
Oh,
people.
2, okay.
So is there a job description for these advisory council members so that we can, as town board members, we know what?
That'd be great, because I don't have anybody right now, but I'll put it on, I'll get it on, we have a February board meeting, if you get it and all that.
So we have advisory council tomorrow, and I was actually gonna present that job description to the group and have them
Perfect.
make sure that it looks good. I'll blast that out. And the goal is, which we will also be working on tomorrow, that the advisory council will, now that we've kind of put some pep back in our step, they will act kind of more autonomously. So I don't have to maybe do one less thing on my to-do list. And we're looking to create some subcommittees within there. One of the subcommittees being an appointment communications. And communications. That's
Yeah,
it.
that'd be
Yeah.
great, because like I said, I have an aging committee now, so they can handle all this review.
Can you
We
remind
just
me
lost
again?
a valuable opportunity because solid waste sent all the seniors for their recycling permits to the town clerks. If I had a sign-up list in my town clerk.
That's right, yeah. We've all been
I've seen
deceived with,
hundreds.
new people coming to the town clerk's office.
Well, and the clerk's left, my clerk left it.
But that's a perfect.
Some do, some don't.
opportunity
Ask
for them
Wendy
to
about it.
get
She can tell you.
You
Can you
know,
remind me again what high cap is?
HICAP, Health Insurance Information Counseling and Assistance Program.
I'm just looking at
Very
that
good.
yellow bar up there.
Yes, and that yellow bar is much higher in this, that's the 4th quarter,
Yeah.
because of open enrollment.
Renewals, right. okay.
Yeah.
Can I return back to the go-go, grandparents? Are there any age restrictions or income restrictions?
No income restriction. It will be an age restriction based on our office, so anybody 65 and up.
Okay. And is that on your website as well?
Not yet, because we haven't officially launched it,
Okay.
but we're in the process of making up the flyers and getting all the
Well,
information.
and if you send the flyer, we can send that out to our email list, our respective email list.
Oh, and you know what? Going back to advisory council for 1 second, one thing that they talked about last meeting was putting our minutes into supervisors' mailboxes. Would that be something that is
Yes,
appreciated?
Absolutely.
You don't want them in your physical mailbox
Digital.
here, you want them
Digital
digital.
mailboxes.
So
Digital
who's
might be
Kelly's?
better.
Right.
So who's Kelly's?
Well, all the departments have the supervisors.
That's what I
email.
see.
Well, then you can graft it into your report, right?
Yeah.
So.
But isn't this go-go grandparent, you're just limiting to Hudson right now?
Just
Right.
So
The
Keenan's
flyer's
not really gonna work.
Yeah.
Well,
Yeah.
that's how I see you upstairs, dear.
I just wanted to clarify
But
that.
it's available in all the boards of Hudson.
Oh, no, I know, but I'm just saying.
Just Joe sent it just to you.
I'm
Yeah,
gonna make
well,
it straight in
Or
my
just the
head, so.
Hudson supervisor.
Yeah,
Hudson
and,
Davis.
and which boards is available currently?
We don't have, it's not live yet.
Okay.
It will be live probably the end of February. That's when we
Gotcha.
officially get it going. More questions?
So I want to throw some more acronyms at you, see if you know what they are.
Hit me.
She did really good with that last
Really
one.
did. Get it right.
Right, I know.
Those are usually in Dan's repertoire.
Right, yeah.
Acronyms.
He uses them. I don't know if he displays them often.
How is that health insurance counseling different than what the navigators do at the healthcare consortium, or is it similar?
It's very similar. I would say probably the only difference would be that our high cap counselors can enroll someone into a plan. We don't typically do that because if they run into problems with that plan down the road, we prefer them to have an actual, what's the word?
Navigator.
Navigator.
Yeah, or insurance rep, you know, somebody who's gonna be focused on that, doing that all the time. That's the main difference, but it is very similar. We work very closely with, Healthcare Consortium during that season.
Thank you.
The only other things I have for you is an energy fair, which you may or may not already be aware of coming up. It's through the Capital Region Clean Energy Hub. It'll be Saturday, February 1st. We're gonna table at. And Age Strong New York State Advocacy Day on February 11th. Another thing I'm presenting to Advisory Council tomorrow. I'm hoping I can bring a couple of our Advisory Council members up to the state with us, just to talk about, you know, pay attention to older folks.
And what is your energy there? What is it?
It's not my energy fair. I know not
just
so
asked
much
you to
about,
pay for it.
yeah, they just asked me to be there. The Capital Region Clean Energy Hub, the fair, to my knowledge, is gonna be a bunch of different organizations, local and state, available to let people know about, you know, how they can save money, make their homes more. green and- You know, I was not gonna
Transition,
get that word
solar,
out.
you know,
So
whatever.
that's happening in Albany. There's not a.
Felicia.
Malaysia, okay.
They're
A couple weeks later, there'll be one at the Chatham Library.
perfect. Yeah, I know they're hitting this area, so they'll be around. Christine,
Bonsack.
yeah.
It's like, yeah.
Do you have the flyer?
I don't have a Chatham flyer, I have a Malaysia flyer. I'd love to, that Chatham is more likely.
Forthcoming.
Thanks.
The last thing, only other thing is, which we'll talk about next month, we have a cook retiring at the end of February. So I'm coming to ask her.
Help.
And heat numbers are high, but not as bad as they were January of last year from what I saw, right?
We've done, I think, way over 500 of this.
Okay.
Oh, my God.
How thick's the ice on Queechee Lake? Is that a good parameter?
Well, the ice fishermen have been out there.
I saw some footprints this morning out there.
First year I haven't put a ski on.
All right, any more questions for,
The wait list for the personal care, is that just because of location or is that?
One of those is someone who I wouldn't consider her technically a wait list, has medical things going on and is not able to focus on us getting into the house right now. She's got other people in there, but she's still on the list to go back to getting an aid. And then the other one, I can't remember off the top of my head. I think we're in the process of getting that in because we just had someone close out or will be closing out at the end of January. This month we're currently in, next month. Oh, and then I'm also, will be on vacation next week, so just so you know.
Good for you.
So this energy fair, it's in Chatham and it's in Malaysia. How can I get it to be in Hudson?
I can connect you with Christina.
Bonsack.
Okay.
It's a weird spelling. So I don't know.
BOHN, SACK.
That's through the climate smart.
Yes.
Down there, yeah.
Supervisor Martin.
Your Hudson rep to that now, that's still,
From Hudson.
environmental,
Yeah.
the guy there,
Oh, Michael.
yeah.
Michael.
O'Hara,
He's in charge of it, isn't he? He's the chairperson.
that's environmental.
He's in EMC, but I thought he was on the climate smart as
Oh,
I
well.
don't
too,
remember
from Hudson.
seeing him at
I don't
the.
either. But I don't always get the full screen,
Yeah.
so. Thank you.
All right, thank you, Director.
Have a nice vacation.
Director Almasi.
So, good afternoon, everybody.
Hello.
Happy New Year. Nice to see you all.
Happy New Year.
Nappy, chap.
What wear the hat?
Nappy, no, I like it.
Got a pizza baseball cap, right?
Polo.
So not a lot of resolutions today, just three, I believe. I'll start us off with my request, financial resolution, a request to renew the allocation of $80,000 of the opioid settlement monies to Reentry of Columbia. This assists them in maintaining an expansion of their workforce. They've expanded it by one case manager.
I'll move it.
Second?
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Second resolution, is to renew a contract with Repeat Business Systems. I
Move it.
believe. Second. They maintain the top of your computers.
Hold on,
And
Dan. I just have to tell.
The van.
Yes.
Did you
Put
skip
on hold
over the
for,
van?
It's not being presented at this time. There's further discussion that's coming up.
Okay.
So for repeat business, I have a motion and a second.
I'm sorry, who motioned? and who seconded?
Matt and Robin.
Thank you.
Further discussion? All in favor?
Aye.
Opposed?
Well, I didn't want to all to be confused and sign
Mike and
that.
Jeff, I don't know.
Photocopiers can get contentious. so
Yeah,
we have to
exactly.
Cross around.
Whichever dynamic duo suits you best. Okay, last but not least, this is a resolution to renew the contract with People USA. That's a peer-based organization that provides the Article 31 clinic with a certified peer specialist. This is an individual that I talked about previously, but in case you've forgotten or need a reminder, this individual is unique because they're able to communicate their own lived experience with the clients that we serve in a way that is different than the licensed clinical staff. It's not indicated for licensed clinical staff who are working as therapists to share whether or not they've had their own history of mental health issues or substance use disorders. But for these individuals, it is appropriate. They build engagement, they build trust, they reassure people in their decision to come and seek help. It's been a very
I'll move
valuable
it.
position.
Second.
Thank you.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Appreciate it. And then there, that's been up list is the overtime report.
Congratulations.
Question. Oh, thank you. For those of you that don't know, Supervisor Adams is pointing to the
Yeah.
article that was written in the Columbia paper about Oxford House. Again, I can't say enough about it. I'm very pleased. Grateful for the county's support to help make that come about. We have yet to launch the house in Greene County. Jamonte Johnson is actively looking for a space. It's been a challenge. I feel grateful that he was able to find a space here in Columbia County for the men's residence. Occupancy is up there. It's listed in the article off the top of my head. It's off of Fairview.
I forget, but-
I forgot what street it was. It says it in there.
It's right where the police chief Franklin lives, right? They're neighbors.
I'm sure she's happy to say that.
She is. They met. It's a good thing, Charlie. It's a good thing. I'll get you the
I
address.
sent
Sorry.
the article out.
What do they do again?
Yes. Oxford House is a peer-led recovery house where all the individuals living in the house have to be sober. They contribute to the operating cost of the house through their salaries, through working jobs, through employment. And everybody in the house has a role, whether it's secretary, treasurer, they all have chores that they're accountable for. And the occupants of the house keep one another accountable. Should somebody relapse, they have to leave the house. They cannot remain there if they're actively drinking or drugging. But they would be welcome back if they were to get the recommended help that they need. That might be detox, that might be inpatient, that might be just upping your game when it comes to 12-step fellowship, whatever it is that's recommended for them to do. They have to be compliant with that in order to be considered for reentry. There's a lot more I can tell you about it.
Is it considered like a halfway house?
No, not necessarily, because it's a house that is run by the individuals themselves. So there's no official oversight. Oxford House Incorporated is a nonprofit, nationally recognized. They actually are international, but there are several hundreds of these Oxford houses throughout the United States. But it's the house regulating themselves. So in that regard, it doesn't have the level of oversight, and it doesn't have staff on site with rules and things like that. The house makes up the rules, the house members enforce the rules, and so on and so forth.
How many people are there and how long can they stay?
There's room for 8 people plus the coordinator. So right now we are funding a coordinator position, which is the gentleman that I mentioned. His name is Jamonte Johnson, who works for Oxford House, and he comes and he, finds the house, furnishes the house, or organizes the furnishing of the house, soup to nuts, and then also, models for the new occupants the Oxford House model of how to live and how to behave and how to occupy the space itself. So there are 7 plus him.
So for Randall's clarification, how would somebody who know to find Oxford House?
And anybody can present themselves to the Oxford House to get in touch with Jamonte. We have our dual recovery coordinator, JP Cahill, actively spreading the word. I'd like to believe it's rather well-known, if not extremely well-known by now throughout the provider community. But beyond that, in terms of like just the general community, if they have a family member or somebody like that, that would be in need of this, we're working on that in terms of marketing and promoting it. Jamonte is at all of the provider, not all of them, as
But it's
many
not
as he can.
typically through an agency. It's you, someone could apply directly. to-
Absolutely.
Right.
Absolutely, but it has been happening
The other
typically
way.
through an agency.
Okay.
Remember that the Red Door, for example, which is a men's community
Mm-hmm.
residence, which you're familiar with, and Riverside would be its counterpart for the women's house that's going to be in Greene County. So Riverside is a major referral source to Oxford House because, the director, Renee Pine, has told me that prior to Oxford House, there was nowhere for the men to go other than back to where they came from, which often is not an ideal environment for their recovery. So to have this as a resource is brilliant and is working nicely so that the men at Red Door can go to less restrictive environment,
Kind of stepping
be
down.
independent, step down,
Yeah.
to feel as though they're living on their own,
Right.
but have the sober support of one another. It's a really, really nice model, and it's early. This went live on November 1st.
Okay.
So it's very, very early on, but it's looking promising. And again, I'm very grateful because the decision was made to use the opioid settlement dollars to kick it off.
And how long can they stay?
Oh, I'm sorry,
Yeah.
indefinitely, as long as the individual would like.
Okay.
The vision though is, as one stabilizes, as one gets better, stronger in their recovery journey and goes from early recovery into middle recovery and then long-term recovery, chances are you're not going to want to live with a group of 7 or 8.
Right.
You want to have your own apartment. You want to move on. Maybe you have a significant other and so on and so forth. So you will eventually launch, but there's no one kicking you out at any point unless you revert to active use.
That's Parkwood.
Thank you. This is our big thank you. We're quick.
I thought you said P.
I said B. For some reason.
That's my
I beat that.
Parkwood. Close.
Feel free to entertain any questions. Don't have a director's report. I'll have one for you next month. But, clinic census is up. We're at about 1,000 admitted cases. I have talked with the committee about the decision to part ways with Novotel. That was the virtual provider that was providing us a nurse practitioner 32 hours a week. We are opting out of that contract as of March 22nd, and we are bringing on a psychiatric nurse practitioner under a civil service title. We've been successful in increasing the grade. It's going to be nice to have somebody in the civil service title working for the county and also saving us some money compared to what we were paying in Novotel. I can go on, but
Good news.
I'll include it in my report of all the other things that are happening on the county, state, and federal level.
In the run up to the state of the state today, they were talking about public safety and the increase in crime, and it was attributed to mental health issues. That's what they said the data would reflect for the report in 2020, at the end of 2024. I don't know if that's consistent with your
Been in
information.
meetings all day. I was hoping to catch the state of the state. Maybe I can watch it online to see what exactly was
It was
said.
the run up. I
They'll
don't know.
decipher it tomorrow.
I heard there's gonna be a lot of talk about children's behavioral health and things like that. Look, to put it simply, I don't know. I mean, mental health gets brought up a lot nowadays. There's a good side to that and a not so good side to that. The good side being that it's reducing the stigma. It's being talked about. It's being recognized. Bad side, it's like, mental health can't be responsible or cure all the
Everything,
ails
right,
in the
right.
world. It just can't. It's deeper than that. We've talked about there. I've spoken about that with, you as a committee previously, and that, this goes back many, many generations of, people, there being a breakdown in the fabric of the families, however you want to define a family, in our culture, in our society, in the way that we are so polarized and divided, the rapidness which we go towards anger and I'll say even hatred towards one another as of late is perplexing. So, does that fit in the parameters of, the tiny little box of mental health? I don't think so. It's deeper than that. But people like to put it in the box of mental health so that, they can speak about it in a more simplistic way.
Well, the one advantage to that is if there's more funding for it.
Yes, absolutely. That's definitely a positive.
Right.
But people are committing crimes, for various reasons. People are stealing because they're starving. That's not because they're mentally ill. They're hungry. They're trying to feed themselves and their family. That's an economic issue. That's, factors that go way beyond my expertise in terms of what's causing people to go to that length.
We'll see what they say.
Yes.
All right, any further questions for Director Almasi? There being none, I'm going to ask for any public comment.
Thank you, everybody.
Thank you, Director. There being no comment from the public, I'm going to ask for a motion to adjourn.
Motion to adjourn.
Second.
All in favor?
Aye.
Good night, everyone. Thank you.
Welcome, everyone. I'd like to call the January 2025 Public Safety Committee meeting to order. This is the first one of the year. Happy New Year to everybody. First one up is probation.
Good evening.
Good evening.
Got one resolution, authorization to accept the 24-25
Move it.
vacation interlock.
Second.
All in favor? Opposed? So carried.
There you go.
Here we go.
Nothing changes. Raise here.
Public defender.
Oh, wait, emergency management.
What's that?
Next. Did you?
Did I miss one? Sorry. Could have, oh yeah.
No. That's emergency.
Oh yeah, emergency management.
I almost got it.
Supervisor, the last time I got up too early before I was called.
Yeah, we
No
yelled at you.
resolutions. Our board is there. Since we've had the cold weather, it's been nice to have the code blue shelter that's been very busy. And my understanding is going very well, but other than that, have any questions, I'd be glad to answer.
I think, the chairman, or DFS commissioner reported that it's full. Yeah.
It's been pretty active.
22.
Yeah.
I'll talk to you
afterwards.
Okay.
Okay.
Thank you.
Thanks, sir.
Public, emergency management, no.
Good evening.
Good evening.
Happy New Year. I have two resolutions. I had a CAFA attorney pass away unexpectedly, and I'm asking for authorization to have the three remaining attorneys, CAFA attorneys, cover his shifts for the next 3 months, when I anticipate that in April I'll have a replacement by that date.
I'll move it.
Second,
Second.
all in favor? Opposed?
These are the nighttime related attorneys, just to clarify.
Yeah, they're 5 p.m. to 9 a.m. and then they do holidays. Those are the folks that do those. And then I'm asking to accept an amendment to distribution number 14, contract C140010. Essentially, ILS is combining a couple of grants to make it kind of simpler to just manage, and I'm asking for authorization.
Move it. Second? Second. All in favor?
Aye.
Opposed? So carried.
Thank you, everyone.
Thank you. 911?
Good evening, everyone.
Welcome.
I have three resolutions for you tonight. First one is, actually, the first two are basically to take grants that are have been awarded and accepted and just bring them into the 2025 budget year. So the first one are for 911 grants.
Second?
Second.
All in favor? Aye. Opposed? So carried.
Second resolution is to bring the emergency management, grants into the 2025.
Second. All in favor? Aye. Opposed? So carried.
Third resolution is the request, to enter into agreement with the Federal Emergency Management Agency Integrated Public Alert and Warning System, which is basically the IPAWS program. Basically, it bridges the gap from our current system of New York Alert. And it gives us some options we don't currently have, one of which is geofencing. So it'll actually target cell phones in a particular area that, of individuals that are not signed up for our New York Alert system. So it kind of gives us a little bit more options.
This is like a new feature with the federal government.
Correct. It came out September-ish of last year. By the time I got all the information and stuff together, we didn't have a December meeting, so.
Yeah.
There's no cost for us. It's all free.
Second. All in favor?
Aye.
Opposed? So carried.
Agency data for November, on the report I sent in. So our call volume was, for November was 3,263 calls. In December, we had 3,462 calls. Normally I do the dispatch, so I couldn't get the stuff together. We just switched over to a new CAD system. So I had to pull reports out of the old one and the new one and merge it. So I'll just read it if it's okay. EMS, we dispatched in December, 1,430 EMS agencies, fire 423 fire dispatches, police 1,407 calls, and then other, which are 911 notifications, the utility companies, etc. 406 calls. And that's all I have.
Thank you.
Thank you.
Fire.
Fire? Oh, yeah. He's not here. George is not here. So, George asked me to read these. One is to reappoint members to the Fire Advisory Board, appoint new members to Hazardous Materials Response Team, and accept donations from Columbia County Fire Chiefs Association.
Looks like in reverse order on this thing.
Yeah.
I'll move them all.
Second? All in favor? Opposed? So carried. Give me another pen anywhere. Thanks. I guess this would be the second one, right? That's all included.
There's a lot of.
Yeah. All right, fire, hold on, reappoint, okay, yeah, these are all.
You did them all, right?
Yeah.
All three of them?
Yep. EMS?
Guess I should say good evening, everybody else said good evenings.
Pretty soon it'll be light out and we won't say good afternoon.
Actually, I'm kind of enjoying
As
that.
am I, TJ, as am I.
Every minute of the time.
Get some things done before we go to bed.
Exactly. In our continuing, this is just an update in our continuing quest in the EMS world, to keep these agencies financially viable. The Pitch Consulting report, if you remember, that we had about a year ago, final conclusion on that. We are searching for a way, one of the conditions was to search for a way to kind of equalize the cost of providing EMS in Columbia County across all the municipalities. So we did meet with all the squads here. The chairman met with them and Supervisor Adams, and basically asked that they would, one thing we need to investigate is what is their actual cost of doing business. They did all agree to submit their financials. Took a while, but as of yesterday, I have all but one, and I will not be able to obtain that one because it's convoluted, but anyway.
We all know what it is.
Yeah. But from what I gathered from looking at it, and again, I'll do a formal presentation next month, put all this together. But basically, everything that the Fitch report said is coming to fruition. Where basically the reimbursement rates are not keeping up with the consumer price index and the cost of doing business. When I looked at it, 3 out of the 5 rescue squads, and I looked at it over a 2-year period, only from the standpoint that they're on a cash accounting basis. So if they buy an ambulance this year, it comes out of this year's financials, so on and so forth. So I looked at it over 2 years, and 3 out of the 5 agencies lost nearly $500,000 over that 2-year period. So we need to make some fixes.
They had like cash reserves that they were like, how did
Yeah,
that
but
work?
some of the cash reserves are dwindling. Okay, and we'll investigate that further. I don't have all that information here tonight. But again, the cost of doing business has risen dramatically. Personnel costs have gone up like 8% in 1 year. Trying to obtain medics, it's like the nursing field or so on and so forth. So we're looking at that, and like I said, I'll bring a formal presentation at next month's meeting that we can start to look at some of these recommendations and the possibilities and distributing the costs equally amongst the county. We're kind of looking at the formula that Chatham has used of using 50% of the parcels in a particular district and 50% of the taxable value in a district, just to see how that comes out. I believe that the county will have to pick up a portion of the cost as well. That would be part of the proposal to kind of reduce the burden on some of the municipalities. But again, next month I'll bring this information. We can look at it. It'll be a start. We want to try to solve this before the 26 budget. That's kind of the goal, to get everything kind of equalized and make sure that these agencies don't go under in the meantime.
Right.
Okay.
How does, I know that, I think at the New York State passed a few EMS related resolutions that we and NISAC have supported.
Yeah.
I know the problem is much bigger than what they passed, but how does that change the landscape? Those resolutions?
Some of the resolutions that were passed basically had to do with performance, and basically it also had to do with community paramedicine and the ability to provide in-house versus transporting to hospital. The other one was being able to transport to primary care centers, urgent care centers versus the hospital, and getting reimbursed from Medicare. So the law's passed, but the operational end hasn't caught up with it yet from a federal standpoint, but it's supposed to like this year sometime. The other issue that's on the table right now that hopefully will come to fruition, and I checked the other day with NISAC, I said EMS has an essential service, which means it will be essential and it'll come down to a county's responsibility to make sure that it is provided. I believe that it's going to be reintroduced again in the 25 in this year's budget coming up in April. I don't know if the governor spoke about it today or not. I didn't see it. But the word is that the two sponsors of that bill were reworking some of the wordage in that bill, and that it's due to be passed.
Interesting.
Hopefully.
Because right now you could just live in an area where there's not adequate service, and the county could just feel like that's not our responsibility.
That's correct. So they're trying to change that. They wanted to push it back on the towns, and I guess the towns fought it back and said, hey, we can't do that. My understanding is that it'll come back to the counties.
Right. Okay. Thanks. Okay.
TJ.
Yeah.
Can I see you after the meeting too?
You can.
Anybody else you want to see?
Yeah.
Well, who wants to go home early?
Any other questions for DJ?
Is there any, do you have any new information on the volunteer fire departments, with the training requirements that the state's asking?
OSHA, the
Yeah,
OSHA
the
requirements.
requirements. Is there
I
any
do not
update on
have that. You'd have to ask George.
Okay.
Yeah.
Cause that's another municipal headache we're gonna have to deal with if we don't get some headway on that.
My understanding is, the last time I spoke to them is that they were looking at taking some of those major requirements out of the, out of the law that they're proposing, but again, who knows?
I do know that, we did the Fitch report, obviously, for the fire as well, but I don't know what the outcome of that has been. So we'll see when George gets here. We should chat about that a little bit.
Yeah.
I mean, the county spent $80,000, $90,000 on
Yep.
these two reports. And they were great information, but they weren't done just solely for that purpose. You know, you want to see something come out of these reports, right?
From an
So-
EMS perspective, we basically have a 3-year strategic plan that we're working on amongst all the agencies. We're divided into committees with a 3-year strategic plan with goals and objectives to try to meet as we go forward. And we spend every other month at the EMS advisory board on these committees, so that our EMS advisory board isn't the same every month of the year. Every other month is a workshop.
Well, this is gonna be peanuts compared to if the OSHA pushes the requirements
Right,
through.
yeah.
We're gonna lose volunteer fire companies, and that's
Well,
already
it's-
10 times the cost of this.
I think it's, you hate to say it, but I think it's slowly happening. And, you know, everybody's kind of like doing this, but
And I know George has been meeting with fire
Yeah.
companies regarding the Fitch report. I'm not sure if he's meeting with the battalions or individual companies, but
I'm pretty sure it's the battalion.
yeah, so I mean, there's a lot of activity going on. We just
Yep.
gotta sort of tie it all in, but you're gonna get us some real, like, sort of scenarios at this point before anything is
Talking
even
points
correct, exactly.
Yep.
Which is
based on data.
correct. So we can bat it around and see how all the supervisors feel and what
Sure.
direction potentially, possibly. I just think it's important that we get numbers out there and data so everybody can sort of look at it. Maybe it's not as bad as everybody thinks, maybe it's worse. I don't know. We haven't seen those numbers yet, so.
I think I think the objective is to make sure that we don't lose these agencies, that we're not behind the horse, okay, kind of ahead of the horse. And that's been the goal, of the whole CCMS system. When we put the system in place 14 years ago, EMS agencies were financially in trouble. By putting this system in place whereby we pay them for calls and standbys, really kind of raise them to the next level. Well, we've reached a new crescendo here, since COVID, due to personnel costs, so on and so forth, lack of personnel and, cost of equipment. I mean, you know, ambulances now.
Yeah, and there's stages to this, as you know, because even if we get everybody on board, there has to be some kind of oversight. And, you know, there has to be a committee, a board, something that's.
I think
has some oversight.
there's been a willingness. It was a huge step for them to submit financials to us.
No, I know. I was at the committee and
Yeah.
there was definitely, they were interested.
Yep.
So it was good.
Yep.
So let's see how it goes. Thank you very much.
Okay.
Thank you. Good job, PJ. Mark, you have anything? Nothing? All right. Anybody on the committee have anything? Anybody in the public have anything? Do you want to meet anybody else? No. Motion to adjourn.
So moved.
Second? Second. All in favor? Aye. Opposed? Okay. Thank you, everybody.